Hello, and welcome to the benefits portion of your new employee orientation. My name is Jennifer Ely, and I work in the Human Resources Department as the Payroll and Benefits Manager. Philong Dealerships offers you and your family a comprehensive and valuable benefits plan. All full-time employees are required to either enroll or waive their benefit elections for our current benefit plan year. Our benefit plan year starts on June 1st and runs through May 31st of each year. Your benefit elections will be made online through the employee self-service portal in Paylocity. To be eligible for benefits, you do have to be a full-time employee. A full-time employee is anybody who is working a minimum of 30 hours a week. You can enroll your dependents to include your dependent children from birth to the age of 26, regardless of their status, a legal spouse, or a spouse that through a legal union between two persons of the same sex, legally married in a jurisdiction that recognizes their marriage. Marriage also includes common law marriages and civil unions. However, it does not include domestic partnership. Proof of dependent eligibility may be required, such as a marriage license, common law affidavit, birth certificate, or court-ordered documents. Eligibility for your benefits is the first of the month following 60 days of employment. So you work for 60 days, first of the month following is when you're eligible to participate in your benefits. Your eligibility date is your effective date. So this is when your benefits are going to start. So based upon the higher date range, you will see what your eligibility date is, when you need to enroll by, and when your benefits go into effect. For example, somebody that was hired from May 3rd to June 2nd is going to be eligible for benefits on August 1st. They will need to make their benefit elections by July 1st so that the benefits go into effect on August 1st. Once you have made your benefit elections, you cannot change those elections throughout the year unless you have a qualified status change. A qualified status change would be something like marriage, divorce, spouse gains or loses coverage through employment, the birth or adoption of a baby. If you're eligible for Medicare or Medicaid, you need to notify me as quickly as possible, but it has to be within 31 days. And as long as we are in that 31-day window, we can make whatever changes we need to make to your current benefit situation. But if it's outside of that 31-day window, you will have to wait until our next open enrollment period before you can make changes to your benefits again. The reason for this is that your premiums are provided to you on a pre-tax basis. So that means the premiums are going to come off of your paycheck first. It lowers your taxable income. You pay less in payroll taxes. So because of that, the IRS says that you cannot enroll or change your benefits whenever it's convenient for you. You can only do this as a new hire during an annual open enrollment period or if you have the qualified status change. The Affordable Care Act went into effect on January 1st of 2014, and this is the law that states that we are all required to have health insurance. So that law is still in effect, so you are required to have coverage on yourself as well as your family members. So we'll start talking about health insurance. We are self-insured here at Philong. Self-insured means that we are the insurance company. So this is not a Blue Cross Blue Shield or a Kaiser or a United Healthcare. We are the insurance company. With the premiums that are collected, we use those premiums to pay your claims. Some important relationships to know about are going to be our providers, the hospital network, the physician network, as well as some pharmacy benefit information. So our hospital network is through Centura Health. Hospital services performed only at a Centura facility are covered by the insurance. If services are done at a non-Centura hospital, they are not eligible for coverage, and you will be responsible for the entire bill. Now, there are a couple of exceptions to this. First is going to be for our employees that are in our remote locations, such as Glenwood Springs, Raton, or Trinidad. There are not Centura facilities in that area. So as long as you are using a hospital or a facility that is within our network, which is the Private Healthcare Systems, PHCS, it will be eligible for coverage. But for our employees that are in Colorado Springs, Denver, Castle Rock, Parker, Pueblo, Canyon City, all of those areas, you are required to use a Centura facility in order for it to be covered by the insurance. So our network of medical doctors and facilities that the health plans use is called PHCS, Private Healthcare Systems. Because we are self-insured, this is going to be the name that your provider is going to recognize for the name of the insurance. So when you're scheduling appointments, you will, and they ask you who's your insurance with, PHCS is who they're going to recognize. So that is the name of the network. You can look for a PHCS provider online by doing a provider search and pulling up either doctors that are in a specific zip code area, or if you have the doctor's name, you can look for that doctor specifically by name, or if you're trying to find somebody maybe in a specialty area, you can pull up that specialty area and a zip code, and it will pull up the providers that are in the PHCS network. Our pharmacy benefit is through Vintegra. This is a nationwide pharmacy network to include Walmart, King Super, Safeway, Costco, and Sam's Club. Most importantly, though, please note that Walgreens and CVS are not covered by our insurance. So you cannot get your prescriptions filled through Walgreens or CVS. But you can use any of those other large box stores, Walmart, the major grocery stores, King Super, Safeway, as well as the Costco and Sam's Club. You do not have to be a member at Costco or Sam's in order to use the pharmacy there. So that might be an option to save you some money by using Costco or Sam's Club. Because we are a third-party because we are self-insured, we do work with a third-party administrator to administer our plan, and that company is Allied Benefit Systems. So they are a health insurance administrator that will administer our health benefit plans. They are responsible for customer service, processing claims, as well as helping you locate medical providers. Allied is not the insurance or the name of the insurance. As I mentioned, we are self-insured, so we are actually the insurance company. The name of the insurance is the network, PHCS. Allied Benefits is a third-party administrator. They do have a member portal that you can use where you can look up your ID card, you can find providers, you can look at benefit plan information such as summary plan descriptions, you can view your claims as well as track where you're at with your deductible and your out-of-pocket spending. You can also access this through your smartphone and download the app to your phone as an icon so that you can access it directly from your cell phone. That way, if you're trying to fill a prescription and you forgot your ID card, you can pull it up right there from your cell phone. Also through Allied, they have a program that is called Allied Advocate. And this is a program that is going to work with you if you have some claims that are pretty complex, you have high dollar claims, or possibly you are having to get some specialty care done. Allied Advocate is going to reach out to you. That'll either be by a phone call or through sending a letter to your home asking you to contact them. You'll really want to make sure that you do contact them because they will take you through the process of making sure that your claims are being processed in the right manner, that you are seeing in-network providers, and that you are not getting billed for things that you should not be billed for. So if you do receive a phone call from them or you get that letter in the mail, please make sure that you do respond to them. So we have 4 plans that we're going to talk about. They are pretty much all high deductible healthcare plans. Each one works a little differently. So I will go over each one of those plans. The first one that we are going to talk about is the Access Plus plan. The Access Plus plan is a plan that has copays for your physician office visits, specialist, urgent care, as well as your prescriptions. So the office visit is a $50 copay, specialist is a $100 copay, urgent care is a $100 copay, and your prescription drugs are in a 4-tier level plan. The generics, the most those will cost you is $15. If that generic is available for less than $15, you will pay the lesser amount. Brand name drugs have a $50 copay. Non-preferred brand drugs have an $80 copay. Specialty drugs have a $250 copay, and those do have to go through a pre-certification process. So if that is something that you are taking a specialty drug or are going to be taking a specialty drug, you will need to work with Vintegra to get that pre-certified. There is a 90-day supply option, so if you are on any maintenance prescriptions, you'll want to make sure that you get the prescription from your doctor for a 90-day supply so that you can get 3 months for 2 copays versus paying a copay each and every time that you fill that prescription. So that can help you save some money. So anything outside of those services, an office visit, specialist, urgent care, or your prescription drugs, you are now subject to the deductible. The deductible is $2,500 for an individual, $5,000 for a family. Once you've met your deductible, then the coinsurance kicks in. Coinsurance is the splitting of the bill. This is where the insurance company is going to pay a percentage and you're going to pay a percentage. And this is an 80-20 split. So the plan will pay 80% of the claim and you will pay the remaining 20% of the claim until you reach your out-of-pocket maximum. Out-of-pocket maximum on this plan is $5,000 for an individual or $10,000 for a family. If you were to reach maximum out-of-pocket in a plan year, this is when you would be covered at 100% for the rest of that plan year. All of your copays do apply to your out-of-pocket maximum, as does your deductible. So any copays, any deductible amounts, any coinsurance amounts, those all do apply to your out-of-pocket maximum. You'll see the rates here on the top of the page. All of the rates that we have listed in our presentation today, as well as on the employee self-service portal, are going to be listed on a per paycheck basis. So you're paid twice a month. This is the amount that you would see coming out of each paycheck. As a new employee, you will come in at the standard rate unless you are a tobacco user, and then you will pay the tobacco rate. The wellness rate is a program that you have to work throughout the year to qualify for it in the next year. And we will have more information on our current wellness program sent out in the near future. The next plan we're going to talk about is the high deductible healthcare plan with an HSA. So an HSA is a health savings account. So on this plan, you do have to meet your deductible first, which is $1,400 for an individual or $2,800 for the family. And then once you meet your deductible, then your prescriptions will go into a copay structure, and it's that same 4-tier structure that I just went over. The remainder of your claims will be subject to coinsurance, the splitting of the bill, and it's an 80-20, so the plan will pay 80%, you'll pay the remaining 20%. Until you reach that maximum out-of-pocket. Maximum out-of-pocket on this plan is $5,000 for an individual or $10,000 for the family. Again, if you reach that out-of-pocket maximum in a plan year, you'll be covered at 100% for the remainder of that plan year. So again, you can see those rates listed along the top. Please remember that they are on a per paycheck basis. So with this plan, you have the health savings account. What is a health savings account? A health savings account, HSA, is an account that is opened in your name. You determine how much money you want to put into this account, and it comes out of your paycheck on a pre-tax basis. So it lowers your taxable income. Those pre-tax dollars go into your HSA account, and you can use that money to help pay for medical expenses on yourself as well as any of your eligible dependents. So this could be things like your routine healthcare, your office visit, x-rays, lab, hospital expenses such as room and board or for surgery, medications. You can use it to do dental care as well as vision care. And again, this is money that you can use on yourself as well as any of your eligible tax dependents. The health savings account does have a long-term benefit to it. By setting aside this money on a pre-tax basis and growing this account over the years, you're able to lower your taxable income, pay less in payroll taxes, have money set aside to pay for medical, dental, and vision expenses with pre-tax dollars instead of after-tax dollars. And then there's also some great savings to it so that you can set aside money to use when you get into retirement. So as you reach retirement, you can use money in your health savings account to help pay for medical expenses at that time. You can also take money out of a health savings account when you reach retirement. You would just pay taxes on it at that time. So it's a little bit like a 401k in that aspect. So some great long-term benefits with your HSA. There are annual limits that the IRS sets up for the HSA. So annually, you're only allowed to contribute a certain amount, but overall, your HSA account balance, there is no limit. So the more that you can contribute, the more that you can save. There's no limit on that, the overall account balance. It's just annually. So for this year, self only, you can set aside up to $3,600. If you're family, it's up to $7,200. If you are 55 or older, there is a catch-up contribution that allows you to contribute an additional $1,000 into your HSA. All right, the third plan we're going to talk about is the High Deductible Healthcare Plan, HRA, which is a health reimbursement account. This plan is pretty similar to the last plan we just talked about, the High Deductible Health Plan that has an HSA. It's just the spending account is different. So on this plan, you have to meet that deductible first, $1,400 for the individual, $2,800 if you're family. Then your prescriptions will go into that 4-tier copay level. The remainder of your claims will be subject to coinsurance, the splitting of the bill, and again, it's an 80-20 until you reach your out-of-pocket maximum. Out-of-pocket maximum on this plan is $5,000 for the individual or $10,000 for the family. Again, if you reach that annual out-of-pocket maximum, you will be covered at 100% for the remainder of that plan year. So the health reimbursement account, this is an account that the employer opens for you, and the employer puts in a contribution that you can use to help pay the deductible on your healthcare plan. So this is the employer account. It is employer money. It is an annual contribution that is done at the beginning of the plan year. For employee only, it's $600. And for an employee with dependents, it's $800. Now, if you don't use any of that money or you only use a portion of that money throughout the year, the balance does roll over from year to year to a maximum of $2,400 if you're employee only, or $3,200 if you are an employee with dependents. New hires do receive a prorated amount based upon when you enter the plan. This account is not portable, so if you leave employment with Phil Long or you change plans, you do forfeit that balance. Again, employer's account, employer's money. So what can you use an HRA for? You can use your HRA for routine healthcare expenses such as the office visit, x-rays, labs, hospital expenses, medications, deductible, copays, and coinsurance. It cannot be used for dental or vision expenses. The HRA is designed to help you pay the deductible on your healthcare plan, so it can only be used for expenses that would be covered by the health insurance plan. No dental or vision expenses can be used with the HRA. The last plan we'll talk about is the Value HRA plan. And this plan is a true high deductible health plan. So at no time do you have copay options. With this plan, you have to meet your deductible, which is $2,000 for an individual or $4,000 for the family. Once you meet your deductible, the remainder of your claims will be subject to coinsurance, and it's a 70-30 split. So the plan will pay 70% of the claim and you'll pay the remaining 30% of the claim until you reach your out-of-pocket maximum. Your out-of-pocket maximum is $6,550 for the individual or $13,100 for family. With this plan, you also get that HRA account that we just talked about. So that employer account, employer money, employee only receives an annual contribution of $600, or an employee with dependents a contribution of $800 that you can use to help pay the deductible on the healthcare plan. So those are our 4 healthcare plans. Again, those rates are all listed in your in the employee self-service portal and throughout the presentation on a per paycheck basis. All new employees will come in at the standard rate unless you are a tobacco user, and then you pay the tobacco rate. And then you do have an opportunity to participate in wellness throughout the year in order to be eligible for the wellness rate in the next plan year. Some cost savings tips with to help lower your out-of-pocket expenses. First is a pre-certification program. So there are certain items that do have to be pre-certified in order for the insurance to cover this. If you do not get it pre-certified, you could be subject to a $500 penalty for non-compliance. So this is going to be things like a hospitalization, like an inpatient situation. It's going to be for surgery, whether that be inpatient or outpatient, specialty testing, specialty scanning, cancer treatments, those types of things. Those all have to go through that pre-certification process. There is a complete list of those in our summary plan description, which you can find on the employee self-service portal, as well as through the Allied Benefits System portal. Emergency room versus urgent care. So this is a big one. Emergency rooms charge 12 times more than what a primary care doctor would charge, and 10 times more than what an urgent care facility would charge. So emergency rooms are to be used for true emergencies, sudden, unexpected medical conditions that would endanger a person's life or seriously harm the person's health if it's not treated immediately. Urgent care is for conditions that require attention but are not an immediate threat to your health or life. If the urgent care provider thinks that you need a higher level of care, they are going to get you to the emergency room. So if you're not able to get into your doctor or into one of the clinics, try to go to an urgent care center. Urgent care centers can treat a lot of the things that people are going to emergency rooms for and being charged a lot more money for that. So urgent cares can handle the colds, the flus, the coughs, the runny noses. They can handle the sinus infections and the bronchitis and those types of deals. Save the emergency room for true emergency events. For our employees that are in the Colorado Springs and Denver area, if you choose to enroll in our health insurance, you do get access then to the Care Here clinic. Care Here is a clinic, a health and wellness clinic that is essentially just like a primary care doctor's office. And you can use this for anything that you would do with a primary care doc. So it can be for chronic disease management, care for infections and colds, your annual checkups, wellness programs, and they also have some weight management courses. They have some health coaches that you can work with if that's something you'd like to do. But the benefit to using one of the Care Here clinics is that there is little to no cost to use the clinic. The only time there is a fee associated with using the Care Here clinic is if you are enrolled in a health savings account. If you are enrolled in a health savings account, due to IRS regulations, there would be a fee for any non-preventative visits. So this could be for, like the coughs, the colds, the flus, the aches and pains, the bumps and bruises. But if you're going for a preventative service, such as your annual checkup or physical, then there would be no fee. But otherwise, there is a $35 fee to use the clinic if you are in the health savings account. If you do not choose the health savings account, then there is no fee, no copay, no deductible, no coinsurance to use the clinic. You can get your blood work done there, even if another doctor's orders it. If you get it done through the Care Here clinic, it's not going to cost you anything. If you go to like a Quest Diagnostic or a LabCorp, doesn't matter which plan you choose, you will be subject to deductible and coinsurance on lab work. So if you can do it through the clinic, it's not going to cost you anything. They have approximately 150 different generic prescriptions on site. So if you're able to use any of those generic prescriptions, you can get those for no cost. So again, it can be a great cost-saving feature for you. You do have to be enrolled in the health insurance to use the clinic, as well as your dependents. They would have to be on your plan in order to utilize the clinic. For our employees that are in the Glenwood Springs area, if you go to Glenwood Medical Associates, there will be no fee for your office visit. So you can save on some out-of-pocket expenses if you're in that Glenwood Springs area by using the Glenwood Medical Associates. If you're down in the Trinidad or Raton area, if you use the Salud Mount Carmel Clinic that is in Trinidad, again, there would be no fee for your office visit. So there's some ways there to help save that money on those out-of-pocket expenses. There is that HSA rule, though, that does go into effect. So if you do have the HSA, there is a $35 fee to use either the Glenwood Medical Associates or the Salud Mount Carmel Clinic. But that's only if you have that HSA. Otherwise, there would be no fee for the office visit at Glenwood Medical Associates or Salud Mount Carmel. Our employee assistance program through Centura Health, which is the hospital network, this is a program that's available to all of our employee members as well as their family members, and they can provide you with confidential professional counseling services that to deal with stress, depression, anxiety, relationship and family issues, as well as other emotional and mental well-being. So this is a free service to our employees. It is completely confidential. You can contact them and they can set you up with the appropriate counselor. You can meet with that counselor up to 5 sessions per person, per problem, per year. And again, this benefit is available to all of our employees as well as their family members, and there is no cost. And just to wrap up on the health insurance, to be a better consumer with high deductible healthcare plans, you do want to be a better consumer of your healthcare and your healthcare dollars. So some helpful tips, make sure that you're taking good care of yourself. So, get regular sleep, get your regular checkups, try to get some exercise. Know your numbers. So get that annual checkup, get your physical so that you know what your blood pressure is, what your cholesterol is. Um, become familiar with your plan and know what your deductible is, know what your out-of-pocket maximum is, know what network you need to use and which providers are in that network. There are some online tools out there that you can use to get cost estimators. You can get second opinions. There is telemedicine is available through our plans, and so if your doctor will do telemedicine, that is an option for you as well. Can often save you a trip, to the office or to an urgent care center. And then shop around for your prescription drugs. So prescriptions are they're not completely fair throughout. So every pharmacy can charge a different price for the exact same prescription drug. So you want to shop around for those prescriptions. Make sure that you're getting, the best possible rate that you can get for your prescriptions. There's a great website called goodrx.com. If you go to that website, you can enter in the name of your prescription drug, and it will pull up the pharmacies in your area and what they are charging for that prescription. Use generics if you can. Use that 90-day supply option if you can. If you're in Colorado Springs or Denver and are able to use one of the Care Here clinics, use those to get your generic prescriptions. And then the last tip is understand your bills. So with insurance, when a claim is submitted to the insurance, they are going to process that information and submit an explanation of benefits to you. An explanation of benefits is not the bill. This is explaining to you how the insurance is going to pay towards that claim. The bill is going to come from the provider. You need to make sure that the bill from the provider and your EOB match up. If those don't match up, then there's a problem in processing that claim. There's maybe something that the doctor's office is charging you for that they didn't submit to the insurance company. If you get just a bill and you never get an EOB, then that means they never submitted it to the insurance claim for processing. So don't pay those bills until you have an EOB to go along with it. And you can get your EOB from the Allied Member Benefit website. All right, so other voluntary benefits that we offer, we'll talk about. Vision benefit is through iMed. iMed is primarily used at LensCrafters, Pearle Vision, Sears, Target, and JCPenney Optical. But with the vision benefit, you can get an eye exam once every 12 months for a $10 copay. You have a frame allowance of $130 at no cost. If those frames are over $130, you will get 20% off the balance that is over $130. Lenses will start out at a $15 copay until you get into a progressive lens, and those will start out at an $80 copay. Then if you want to add anything to your lenses, such as the anti-reflective coating or scratch protection, different copays associated with that, you can see those listed on the screen. If you wear contact lenses, you have that same $130 allowance for your contact lenses, but the balance will be handled differently depending upon the type of contact lens you wear. If you are in conventional lenses, you can get 15% off the balance that's over the $130 allowance. If you're in disposables, there is no discount on the balance over the $130, so you would be responsible for anything over $130. So again, you can get that eye exam once every 12 months, new glasses once every 12 months, and this is through iMed. Our dental, we have 3 different plans to choose from. You have 2 discount dental plans and then dental insurance. The first discount dental plan is through Alpha Dental. The most important thing to know with the discount dental plans is that you are required to select a dentist from their network and use that dentist in order to receive the discounted rate. So again, it's it's a discounted benefit. You're getting services at a discounted rate. The Care Choice Dental Plan is also a discount plan. With the Care Choice Dental Plan, again, you do still have to select a dentist from their network. They do have a little bit of a larger network than the Alpha Dental Plan. But again, select a dentist from that network and then you can get your services at a discounted rate. The dental insurance is through Unum Dental. This is a PPO plan. With this, you do have a calendar year deductible of $50 per person, up to $150 for a family. Your preventative care, as long as you stay in the network, is covered at 100%. Out of network, it's covered at 90%. Basic care is an 80-20, so Unum will pay 80%, you pay 20%. Major care is a 50-50, and orthodontia is a 50-50. But orthodontia does have a lifetime annual maximum of $1,000. So that is the most that they will pay towards orthodontia, and it's for dependents only to the age of 19. With the Unum Dental, you do have a calendar year maximum of $2,000 per person per calendar year. What that means is that Unum Dental is only going to pay $2,000 towards your dental claims per person per calendar year. If they reach that $2,000 maximum, then you will be responsible for any of the additional work done throughout the year. That exceeds the 2,000 maximum. They do have a carryover benefit, though that's pretty nice. The way that this works is that as long as you have your annual cleaning once a year and your dental claims do not exceed $800, then they will carry over a portion of your annual benefit maximum into the next year. So they could carry over up to $1,500. So that means in the next calendar year, you could have the potential of $3,500 benefit maximum to use towards your dental claims. But that does require that you get at least one annual checkup, one oral exam per year, and that your dental claims in that year do not exceed $800. So with the dental, we do have the rates and the vision rates listed there for you. You will also find them on the employee self-service portal. So you can see, and again, all rates listed on a per paycheck basis. All right, a flexible spending account. A flexible spending account is an account that allows you to set aside money to come out of your paycheck on a pre-tax basis. It lowers your taxable income. You pay less in payroll taxes. And then you can use that money to help pay for your medical, dental, and vision expenses on yourself, as well as any of your eligible dependents. Now, this sounds a lot like the health savings account that I already talked about. But a health savings account is tied to my insurance. So I have to be enrolled in a specific type of healthcare plan in order to have a health savings account. A flexible spending account does not have that rule. So it doesn't matter what kind of insurance I have or who I have my insurance with. So even if I don't have it with Phil Long, I can do a flexible spending account. So there is a healthcare flexible spending account. There is a dependent care spending account. So this is for things such as daycare. And then if you are enrolled in that health savings account, there is an option for a limited purpose FSA, which would allow you to set up money to help pay for vision and dental expenses. So it's a great way to save money on your out-of-pocket expenses, but you do have to do some planning on your part. So you do have to sit down and estimate your expenses to the best of your ability so that you can set up your funds accordingly. Because there is a benefit rule with an FSA that's called use it or lose it. And the way that that works is at the end of the benefit plan year, so for us that's May 31st, if you have $500 or less in your flexible spending account, that money will automatically roll over into the next plan year, and you can use that money in the next plan year in addition to whatever you set up for the new plan year. But if you have anything in excess of the $500, you could lose the difference. So with a flexible spending account, you do have to sit down, estimate your expenses so that you set up the money accordingly and you don't get into a situation where you could possibly lose your funds. You can use the flexible spending account for any of your co-pays, deductibles, co-insurance. You can use it for the dental work, the vision work. So chiropractic care is a popular thing that flexible spending accounts are used for, as well as LASIK eye surgery. So different things you can use that for. As I mentioned, if you do choose the health savings account, you do have an option to add on a limited purpose flexible spending account. So this allows you to set aside money for vision and dental expenses only. So if you do have, and if you do enroll in the flexible spending account or the limited flexible spending account, you will have access to an online portal through iSolved. That is who we use for our flexible spending account, health savings account, and health reimbursement account. So you can get online, you can look at your claims, submit claims for reimbursement, process, whatever you need to do there. You will receive a card for this. It's called a Benny card. And then you can use that Benny card to pay for those expenses as you incur them, as long as you have, the available balance on your card. And the money is automatically deducted from your account, and then you don't have to file a claim and wait for reimbursement. So you will receive a Benny card in the mail. So with that flexible spending account, the IRS does set limits to this. So the most that you can set up in the plan year is $2,750 for medical. And then if it's for dependent care, the most you can set up is $5,000. But keep in mind that you can only roll over up to $550 in your flexible spending account. If you have anything in excess of that, you will lose the difference. All right, life insurance. We do have a company paid policy, which is a $15,000 benefit to you, a $3,000 benefit to your spouse, and up to $1,500 on your dependent children. Now, dependents with life insurance are a little bit different than they are with your health, dental, and vision. On health, dental, and vision, I can have a dependent on my plan to the age of 26, regardless of their status. But with life insurance, that dependent rule is to the age of 19, unless they are a full-time student. And then if they are a full-time student, it is to the age of 25. So different rules for the life insurance on your dependents. So this coverage is paid for by the employer. There's nothing you need to do for this other than set up a beneficiary. So if something were to happen to you, who do you want that benefit to go to? You do have an option, though, to purchase additional group term life insurance. Group term life tends to be a more affordable way to get coverage. Rates are based upon entire group instead of you individually. While you are newly eligible, there is a guaranteed issue of up to $120,000. So guaranteed issue means no questions asked. You can elect more than that. You can go up to $500,000 or 5 times your annual earnings, but you will now be subject to E/I, evidence of insurability. It's a medical form that you have to fill out, and based upon the results, they will say yes or no. If they say no, you still keep your guaranteed issue of $120,000. You would just not get anything in excess of that. There's guaranteed issue for your spouse, which is $50,000. There again, you can get more coverage on your spouse, but now your spouse is subject to EFI. With your dependent children, you can get coverage up to $10,000. There is a rate calculator in the employee self-service portal, so it will automatically calculate it for you. But we do have this information available on the employee self-service portal as well if you wanted to do a manual calculation. Short-term disability, this is paycheck protection. So if you become sick or injured and you're not working, if you're not working, you're not making money. So with short-term disability, this can supplement your income while you are out recovering. With short-term disability, you do have to be out of work for 7 calendar days, then starts paying on the 8th day up to 12 weeks of coverage. There is you can elect either 40 or 60% of your earnings, and premiums for this are going to be vary because it's going to be based upon your earnings and your age. So again, the system is designed to calculate that for you as you're going through your benefit election process, but you do have the worksheet available through the employee self-service portal if that is something that you want to do on pen and paper. Long-term disability, so this is if you're out of work for 90 days. So if you've been out of work for 90 days, this will pay you on a monthly basis up until you can return to work. And if you're not able to return to work, it will pay you up to a 2-year maximum. So similar to the short term, you can elect either 40 or 60% of your earnings. And the premium is going to be based upon your income as well as your age. But again, you do have to be out of work for a minimum of 90 days, and the maximum benefit is 2 years. Accident insurance. So accident insurance is if you are involved in an accident, whether it be on or off the job. This can help you pay for out-of-pocket expenses, such as copays and deductibles. So what it does is it pays you a cash amount, and you do what you need to do with that cash. So most people are going to use it to help pay for those out-of-pocket expenses, but you can use it for whatever you want to use that money for. Critical illness insurance. So this is if you're diagnosed with a critical illness, this will pay you a lump sum benefit. Again, you can do whatever you need to do with that cash, whether you use it to pay for medical bills or to help replace some lost income. So with critical insurance, there is a guaranteed issue of $20,000. You can elect up to 50, but you'll be subject to the EFI. You can get coverage on your spouse up to $30,000, but the spouse coverage, there is no guaranteed issue, and you will have EFI on your spouse. And then your dependent children are automatically covered at 50% of your benefit. So again, the rates are in the system to help calculate those, or you can do it listed through the worksheet. Hospital insurance. So this requires admission to the hospital. So if you are admitted to the hospital, if you have an inpatient surgical procedure, if you had to go to the emergency room, or if you had an ambulance or an air ambulance transportation. So again, that money's paid to you directly, and then you do what you need to do with that cash. All right, AROG Legal. So this is a legal plan that if you decide to enroll in this, this gives you access to their network attorneys. And if you use their network attorneys, you can get those services at no cost. So this can be for things like consumer protection, some criminal matters, debt-related matters, driving issues, family things. So different stuff there. You can see the examples of what could be covered by the plan. So again, you do have to use one of their network providers. There's about 14,000 network providers to choose from. And as long as you're using those providers, then you can get some assistance with your legal issues. They can make phone calls, they can write letters, and it can include up to representing you in court. All right, so 401k. So we do have a 401k plan. So 401k is a way for you to set aside money to start saving for your retirement. The earlier you start, the better off you'll be because you have that time to compound your money and let it grow year over year. So you can see some examples there. If you were to start saving at age 25, 35, or 40, what that would look like over time with compounding. We do have two options to choose from on our 401k. There is a pre-tax benefit, the traditional 401k, where the money comes out of your paycheck on a pre-tax basis. It lowers your taxable income, goes into your 401k account. When you withdraw money from a traditional 401k, that is when you start to pay taxes on that money. And the intentions are that by the time you reach retirement, you should be living in a lower tax bracket. So you would be paying less taxes on that money in retirement than what you are paying on that money now. But there is another option, which is a Roth 401k. So a Roth 401k allows you to put that money in with after-tax dollars. So the money goes in with after-tax. When you retire and you take money out of a Roth 401k, you don't have to pay taxes on it because it went in with after-tax dollars. To be eligible, you do have to be at least 18 years of age. Both full and part-time employees are eligible. You are eligible upon meeting 3 months of employment. Once you become eligible, unless you opt out of the plan, you will be automatically enrolled at 5% of your gross pay. So once you become eligible, you will receive information in the mail at your home address from Fidelity Investments. That is who we use for our 401k plan management. So that letter is going to notify you that you're eligible to participate. And again, if you do nothing, you will be then automatically enrolled at 5% of your income. Now you do have an option to change that percentage. So if you want it to be higher or you want it to be lower, you can change that percentage as often as you want throughout the year, up or down. There is also an annual auto increase, which will increase your contribution rate by 1% every January 1, unless you opt out. And it will do that up until a maximum of 10%. So this is kind of a nice feature actually, because most of us, when we start participating in our 401k, we don't give it a lot of attention. And so with the auto increase, every year it would bump it by 1%. And so that each year you're contributing more and more to your 401k. And most of us are not going to notice a 1% difference in our pay. So it's just a nice way to get that number up and contribute more and more. We do have an employer match. It is a discretionary match, and we will match 15% of the first 5% of the employee's deferral every pay period. We do reserve the right to adjust that at the end of the year. So what that means is based upon the year and the profitability of the year, there could be an additional contribution, a one-time contribution to your 401k based upon profitability. So that is a discretionary match and a discretionary adjustment. The 2021 limits, so the most that you can set aside in your 401k between pre-tax and Roth is $19,500. And if you're 50 or older, there is a catch-up contribution that allows you to contribute an additional $6,500 into your 401k. As I mentioned, we use Fidelity Investments to manage our 401k. They have a great website that you can get out on, track your balance, change your percentage. You can change where you're contributing your money. So lots of information out on that Fidelity website. So make sure you check that out once you become eligible. Our Employee Assistance Fund, this is a fund that was established in 2013 for the sole and exclusive benefit of our employees. The Employee Assistance Fund provides financial assistance to employees who are experiencing severe financial distress as a result of an extraordinary emergency or catastrophic event. So this could be things such as a death in the immediate family, medical expenses in the immediate family, expenses due to a natural event. So the employee can apply for assistance from the fund, receive up to $1,000 in their first year of employment and up to $2,000 in their second year of employment. It is not a loan. That money does not have to be paid back, so that money is given to them to help them through the expenses that they're incurring due to things such as a death in the family or a medical expense in the family. But the only way this fund works is through employee donations. So if this is something that you would like to contribute, you can do it on a per paycheck basis and to contribute to our Employee Assistance Fund. It's a great way to help each other out. And then you never know when you might be in that situation where you may need some help as well. Mount Carmel Insurance Agency. So we do have an internal insurance agency that does auto, home, business, and life insurance. It's an independent insurance brokerage firm. So they can help you with looking for new carriers. They will shop around the carriers for you so that you can get quotes from numerous carriers and competitive options. And they work as the broker, so they represent you, the client. They don't represent the insurance company. So if that's something you're interested in, maybe you need to get your current coverage checked out just to make sure that you have the right type of coverage for your needs, please contact them and they can help you with that. We do also have a relationship with our Mount Carmel Veterans Service Center. This is a nonprofit that was founded by Jay Chimino to support our local veterans, military, and their family members. They provide lots of different services to help our veterans, military, and their family members integrate into the civilian world as they're transitioning from active duty into retirement. They have behavioral health counseling and wellness programs, supportive case management, as well as resource navigation and employment and transition programs. So if this is something that you would like to donate to, you can also do that on a per paycheck basis, and you will see that when you're going through your benefit elections. For employees that are reaching Medicare age, or maybe you have family members that are reaching Medicare age, we do have a relationship with a company called Medicare Transition Services, and they can help you with those steps that need to be taken to get ready for Medicare. They can also help you look for supplemental plans when you do enroll in Medicare. So this is a free service to you. It doesn't cost you anything, but Medicare can get really confusing. Very overwhelming. So this is a great resource to help you through those steps and help you through that process to make sure that you've got all your ducks in a row when you're getting ready for retirement. Again, it can also be used maybe for somebody in your family that is getting ready for retirement as well. All right, paid time off, PTO. All employees are eligible upon hire. Part-time employees will accrue at a prorated amount. So PTO is an all-purpose time off plan to use for vacation, illness, injury, family sickness, or activities, as well as personal business. You do need to schedule your PTO in advance as much as possible, and that is done through the employee self-service portal. The minimum amount that you can request in a day is 1 hour. The maximum amount that you can request in one day is 8 hours. So you will do that through the employee self-service portal in Paylocity. The shot you see on the left is if you log in to through the desktop version, or you can do it through their mobile app. I would strongly encourage you to download their mobile app because it's a lot easier to do the PTO through the mobile app. It's so much quicker and right there on your phone, and it's done. If you leave employment with Phil Long, you do stop accruing PTO upon your last day of employment. PTO cannot be used to extend your last day of employment, and you will only receive 50% of your unused PTO upon termination. The accrual consists of 50% for vacation and 50% for all other time off, such as sick time, personal time. Vacation is an earned wage, and so that earned wage does have to be paid out upon termination. Other time off, such as sick and personal, is not an earned wage, so that does not have to be paid out upon termination. If you are a rehired employee, if you are a former employee with less than 1 year of service and you are rehired, you will be considered a new employee with no prior service recognition for PTO accrual. Former employees with less than a 2-year break in service, the employee's seniority for PTO will be based upon the most recent rehire date prior to the current rehire date. Former employees with more than a 2-year break in service will be considered a new employee, and you will not be eligible for prior service recognition for PTO accrual purposes. So the accrual, if you are in your first year of employment, you will accrue 2.67 hours of PTO every pay period. Once you start your second year of employment, you will then start accruing 4.33 hours of PTO every pay period. There is a max accrual. So if you reach your max accrual, you will stop accruing time off until you take time off. Hourly employees will be paid their hourly rate. Salary employees are paid a continuation of your salary. And commissioned employees are paid an average earning for the prior 12 months. So if you are a commissioned employee and you request PTO, they're going to look at your prior 12 months of earnings to come up with an average hourly rate, and then use that hourly rate to pay your PTO. Okay, payroll. So the employee self-service portal is pretty critical when it comes to any of your payroll information. So the employee self-service portal will provide you with a convenient self-service access. You can access it on-site or off-site. You can do it through a desktop, a laptop, a tablet, or your smartphone. So it's easy access, real time, where you can view checks, submit time off requests, add or change direct deposit information, change your withholding, access W-2s, and more. So as I mentioned a few minutes ago when we were talking about PTO, I would strongly encourage you to download the Paylocity app on your phone. This way you can look at your paychecks through your phone, request time off through your phone. So lots of information in there right at your fingertips. Timekeeping. As an employer in Colorado, we are required to keep accurate logs of hours worked by each of our employees. So what this means that this means, except for managers, all fill-on employees are required to clock in and out each day. So you do have to clock out at the beginning of the day and at the end of the day. If you go to lunch, you need to clock out when you leave for lunch and clock out when you come back from lunch. If you forget to punch in or out, you need to let your supervisor or manager know right away so that they can get your time card corrected. So you will do that through Paylocity, the employee self-service portal. So when you log into the employee self-service portal, you come to a home screen and you will see the time clock right there where you can clock in, clock out, or clock out for lunch or end your lunch. Some of the employees, especially in the parts and service department, will have access to a quick link to clock in. So if you have the quick link, you enter your employee number, and then it brings you to a screen where you can clock in or clock out. But please just make sure that you are clocking in and clocking out every day. We are paid twice a month on the 15th and the 30th. If payday falls on a Saturday, we pay the Friday before. If it falls on Sunday, we pay the Monday after. Our pay periods are the 6th through the 20th is paid on the 30th of the month, and the 21st through the 5th is paid on the 15th of the month. That really only affects people that are paid hourly and technicians that are paid flag time. So anything worked between the 6th and the 20th will pay on the 30th. Anything worked between the 21st and the 5th will pay on the 15th. Draws or salaries for commission employees are paid on the 30th for that month. And then your commission for the prior month will be paid on the 15th of the following month, less any draw that you received prior month. So commissions are paid on the 15th of the following month. Draws or a salary are paid on the 30th of the month for that month. If you think there might be something wrong with your check, please check with your store payroll contact or your manager. If a correction needs to be made, then they will contact our centralized payroll department to issue a check. Centralized payroll does not calculate pay, they process pay. So if you have questions about your commissions, you really need to start at the store level because centralized payroll doesn't have the detail behind your commission. They just have the amount to pay you. So there's a list of all of the pay periods and pay dates for about the next year. And then our payroll contacts. So this is available on the employee self-service portal. So when you're ready to make your benefit elections, again, you'll do this through Paylocity, the employee self-service portal. You will log in, and on the left-hand side, under the HR and payroll tab, there will be a drop-down of menu selections, and you will click on Enterprise Benefits. When you click on Enterprise Benefits, this will take you to a new screen where you will click on Start Your Enrollment. And when you click on Start Your Enrollment, it will take you through a step-by-step process of making your benefit elections. Please make sure that your benefit elections are done prior to your benefit effective date. You will be receiving a benefits guide. It will be available online. It's available as part of this training, so you will see it as an attachment. It is a digital benefits guide that you can just pull up and look at on your screen, or you can download it as a PDF and print it or save it on your desktop, whatever you need to do. But please make sure you keep the guide as a reference. There's a ton of information in there. We have the contact information for our benefit providers, as well as for our HR department, risk management, myself, and our payroll department. So lots of information in there. The best way to get a hold of me is going to be through email. My email is jely, J-E-L-Y, @phillong.com. Best way to remember that is it's jelly with one L @phillong.com. But email is the best way to get a hold of me. So please send me an email. I'll get back to you as soon as I can. I appreciate you taking the time to view this. Please make sure if you have questions or need assistance that you reach out to either myself or our Human Resources Department and we can assist you. But thank you and welcome to Phillong Dealerships.